Today, we are proud to present Environ's Cool Peel technology. We're going to dive deep into the USPs of this great series of treatments, and it will really help you not only build your service or treatment menu, but it also shows you all the different treatments you can have in your Environ toolbox to showcase to your clients. Just a little reminder of today's agenda. We are going to talk about the theory of cool peels first. We'll then talk about how the practical component or the treatment is done. Here in Ontario, due to masking regulations, we're not doing a live treatment today, but we have some great video footage. And good news, in the coming weeks, we'll be doing some live demonstrations as well. If you ever want to recapsulate or revisit the education you've received today, we encourage you to log into SkinHealth Canada. Go to the SkinHealth College, and there you can see the Environ training. Under professional, you will find the cool peels. There will be a recorded video there, much different than what you have today, but still great content. And you can also download our Environ learner workbooks. And the learner workbooks are great reference points for you to revisit any ingredients, the story of how to communicate a cool peel to your client, etc. So don't forget that amazing tool that SkinHealth College is always there as your library to learn about today. First of all, you will be able to describe the features of cool peel technology. So again, features being the unique selling points and what makes it different in the marketplace. Next, be able to explain the benefits of cool peel technology, what your client will experience, the results of having a series of cool peels. Next, describe the general history and process of peeling, because believe it or not, history it's very ancient. Peeling has existed for thousands of years, so I'll get to that. You'll be able to recommend and execute the appropriate treatment based on your client's skin conditions and their needs. And finally, you will then tie that into your retail range support as to what you will recommend for your client at home. So cool peel technology, of course, coming from Dr. Des Fernandez. Dr. Des not only is one of the leading plastic surgeons in the world, he's the founder of Environ. His research and development into vitamin A makes us really unique in the marketplace and medical grade skincare. He is also a medical esthetician and dermatologist. So when he designed cool peels, he really wanted to have treatment that would go along with Environ's overall philosophy and ethos. And we're going to discover that a little bit more today. When we talk about cool peels and Dr. Des, some of the key things to remember with a peel is what we want to achieve. And that's usually the R's. So refine, revive, retexturize, resurface the skin, and brighten. And if you didn't know this, a cool peel is a great way to jumpstart your client's regime. Okay, again, we know we have DF technology, we have needling. The cool peels is a great way to eliminate any residue, excess skin or dead skin buildup, and excess oiliness on the skin. So we're going to learn all about that as well. And we're back. So that video definitely encapsulates the USPs of an Environ treatment. And if you think about your previous training with the brand, we always talk about starting low, going slow, gauging the skin's tolerance, and that really applies to cool peels as well. So just to sort of discuss what we saw in the video, the unique selling points you want to share with your client is, first of all, cool peels are non-invasive. They offer a low percentage of acid combined with a low pH, gentle yet effective. I think that's one of the most difficult talking points with consumers nowadays, because they're very savvy, they have access to a lot of information, but the truth is high concentration of peels and very aggressive peels are not always the answer. Why? Because not only do they have longer downtime, but when we irritate the skin or we inflame the skin, we actually accelerate the aging process. And that's not Environ's philosophy. They want to have pro-aging solutions. And again, I come from an aesthetics background, and when I worked with my clients for many years in spa, I know that once I induce irritation, I then have to correct that before I can go in and fix all the other things I wanted to address, whether it be fine lines, wrinkles, or pigmentation. So just keep that in mind. You want beautiful skin for a lifetime. It's a journey. So cool peels should be done starting low and going slow. So we'll touch on that when we talk about percentages and the treatment products themselves. Number two, a key point, offers safe treatment, very, very safe and effective with minimal downtime. So for most clients, they could have a cool peel treatment on their lunch break and go back to work, or a day before a big event, because we know the possibility of an allergic reaction is very minor, very slim. So again, minimal downtime. They don't have to hide and wear sunglasses and scarves over their face for 7 to 14 days, like some more invasive products on market. Environ number three is offering slow drying gels and creams, and we'll see more about that soon. 4, a safe and pleasant experience. Client comfort is super important. You want your client to enjoy their experience so they come back to complete their series. And finally, growth factors. What is it we do in skincare? Again, it's all about anti-aging, working on the condition of the skin, and we want to stimulate not only the growth factors, but the collagen production or collagen synthesis of the skin. Let's face it, we all want to maintain that beautiful architecture of our collagen and elastin fibers as long as we can. Once they start to break down or degrade, that's when the aging process really starts to accelerate. So those are some great talking points with your clients when introducing a cool peel. So going back to Environ's peeling principle, they are working on the rehabilitation of cells. So when we talk about cells, we talk about the metabolism and the mechanism of the cells starting to slow down with the aging process. And what we want to do is reboot that or activate that, those different enzymes and different functions of the cells so they work efficiently. Okay, so rehabilitation of the cells to maintain healthy cells. And we want to offer safe precision treatment. So let's get into peeling unpacked, and let's talk a little bit about the history of peeling. So at the beginning of this presentation, I touched on that peels are nothing new. It's just the science, technology, and the overall research and development has advanced so much. And with laboratories and research and development teams in South Africa, we have the ability to really study the effects of the ingredients before we put them to market. But if we go back to ancient civilizations, the Egyptians, for example, were known to use peels. And I often refer to Queen Cleopatra and her milk baths because we know milk is lactic acid, which is not only moisturizing, but it's also it has a keratolytic effect. So keratolytic, it's a bit of a tongue twister. It's that little Pac-Man that gobbles away at those dead skin cells. Only back in history, they were using ingredients that came from fruits, such as fruit acids and other skin irritants. So for example, cinnamon and different spices and different minerals that were in the ground. The problem with that is they had heavy downtime, often up to 3 weeks. And when we use certain ingredients, even when they're natural, if they're not buffered or formulated properly, Again, it instigates irritation and disruption in the skin, and that's where we defeat the purpose we set out to do. Okay, so again, history, we see deep peeling treatments were a part of their beauty regime, only we're so much more advanced today that we can do them without downtime. So what are the risks of deep peeling? And we see many brands on markets where clients are going in for these uncomfortable treatments and they come out and their skin crusts or it sheds like a snake over time. And actually, it can be a very uncomfortable experience for them. So peels that are very deep can be dangerous because they are uncomfortable and they can be painful while the process is happening. They offer a slow healing process. So remember, when you do things that are too invasive for the skin needs time to repair, regenerate, and heal. And this doesn't happen overnight. You can have a peel that is so deep it can result in post-inflammatory scarring. So maybe you set out to treat pigmentation, but when something is too intense for the skin, you actually make the condition worse and you can have scarring as a side effect. You can result in hyper or hypopigmentation. Bacterial infections, this is huge. So Environ wants to maintain the epidermal integrity of the skin and maintain the ecosystem of the microbiome, and of course, work with our skin's natural protective barrier. When a peel is too deep and we compromise that protective barrier that we need to keep things out, foreign invaders, bacteria, and pathogens, the Langerhans cells that lay beneath that we can't see, they are the police. And when the police or the SWAT team is constantly fighting all these aggressors, the barrier is compromised, we're susceptible to infection, acne breakouts, and a whole heap of other conditions. So again, that's a huge one to consider. Deep peels can result in permanent scarring, and they often don't offer results that justify the traumatic experience. So again, setting our expectations with our clients from the get-go is very important, and having the conversation that we want to offer them that's going to be healthy for their skin rather than something that's going to make them feel uneasy and be unpleasant. So just to sort of touch on where this slide is coming from, in our risks of deep peeling, we talked about a consequence of a peel being scarring. So if you look at this lady here, you can see the definite demarcation of where the peel was applied. Many, many layers of skin have been removed, but the result is not only that line, but the texture of the skin is different from the upper portion of her face to that cheek area where the peel was applied, and that scarring can be permanent. So there are many types of different chemicals that are used in the peeling process. And again, sometimes they're from nature and sometimes they're bioengineered in the laboratory, but always keeping in mind that Environ uses pharmaceutical grade ingredient or medical grade ingredient. And I think a lot of our consumers need to understand that. You know, you can have products, for example, in the drugstore or department store, but it's a different grade or quality of ingredients. So having those kinds of conversations is also very relevant today. So some of the chemicals used in peeling, the first one is phenols, which Environ does not use because they can be highly toxic. In very high percentages, phenols have been known to cause death. And what do they do to the skin? Well, they damage that epidermal layer, hence killing or discontinuing that protective barrier we need. And over time, the skin just becomes waxy and thin and very unhealthy. Next, salicylic acid. Well, this one's actually a good one. And although it's a derivative of phenol, in small percentages, it's highly effective. And I love salicylic acid because we see it a lot in our skincare products for acneic or problematic skin. Salicylic acid is amazing because it has the ability not only to work on the surface or topically on the skin, but it has the ability to penetrate the pores at a deeper level and even eliminate any dead skin buildup or unhealthy cells near the hair follicle. That means when we use it for a problematic skin, the skin or the pore now can breathe better. It can do its job of accepting the topical applications, and the permeability is better as well. The only time salicylic is a little bit, well, it's dangerous is if it's used in percentages of 20% or more. The side effects, of course, can be nausea, ringing of the ear, and dizziness. But again, we are using very, very low percentages in Environ products. Next, trichloroacetic acid. Again, this is one you'll see on market with medical grade or different spa peels that are very, very invasive, and they have a lot of downtime. You will see in the images above, you'll often see this crustation that I was referring to earlier, a lot of peeling, and again, the downtime can be up to 14 days. This is a man-made chemical known as TCA, and I don't want you to think it's unsafe because it actually is safe, but only in smaller percentages, not in the high doses that some formulators are using, okay? It is safe because there are no known allergic reactions, and you can get a deeper peel at higher concentrations. So walking away from this particular ingredient, it's not bad, but we just don't want to use those high percentages in the 15s and the 20s. When we use those high percentages, or not us, Environ, but other brands use it, they often require that the client take an OTC medication, so over-the-counter painkiller, like a Tylenol before treatment. And if the peel is too deep, the practitioner may even recommend antiviral or antibiotic medication to reduce swelling and inflammation. And that's what we don't want our clients to have when we do an Environ Cool Peel. So just keep that in mind. And of course, we have our retinoids and our retinols and all of our different esters, because we know, retinol or retinoids come from vitamin A. And vitamin A is phenomenal for the skin. It not only works on the cell renewal process to give us that natural peeling effect, but it also normalizes the skin, boosts our natural moisturizing factors, works on pigmentation concern, even acneic and problem skin. So we know that we use tons of vitamin A with Environ, but we start low and we go slow. Next, we have our alpha hydroxy acids. And alpha hydroxy acids are phenomenal because they come from nature. The traditional 5 alpha hydroxy acids that we think of are glycolic acid, usually coming from sugarcane, lactic acid from milk products. And again, lactic is really amazing because not only does it have that keratolytic or gobbly effect, it's also moisturizing. Citric acid, which comes from citrus fruits, malic acid from green apples, and tartaric acid, which comes from green grapes. Alpha hydroxys have been used for centuries. They have a great carboxylic effect, and again, gentle on the skin. Next, lactic acid. So Environ uses lots of lactic acid. It's very comfortable. There's usually no stinging or prickling sensation when we use it, and it's effective in evening out the skin tone while still focusing on nourishing the skin. And Environ uses L-lactic acid in some of its retail products, and we're going to visit the lactic acid today in Cool Peel. And finally, we have our glycolic acid. So glycolic acid is the smallest molecule of the 5 AHAs. So it's sort of that powerhouse. It has the ability to penetrate the skin at deeper levels. In terms of our Cool Peel treatment technology, we don't use glycolic acid. However, you can find some glycolic acid in our Focus Care Use Plus AHA toner. And just to recap on our AHAs a little bit, you often see a combination of AHAs mixed together. So sometimes you'll see glycolic lactic, sometimes you'll see a lactic acid mixed with malic and tartaric. So the beauty of AHAs is you can blend them together to make very effective treatment. So again, we talked a little bit about peeling complications, and this more so goes for deep peels, but you want to keep this in mind. When you have a deep peel, you may have hyperpigmentation or PIH. Hypopigmentation, again, this often comes as a result of a deep peel, like we saw in the image of the mature lady earlier with the demarcation line and that difference in texture between the lower portion of her face and the upper portion, because the deep peels are destroying the melanocytes of the skin. Allergic reactions, very uncommon with a peeling product, but we know it can happen. Overtreatment. So again, when we use too many deep peels over a short period of time or even over a long period of time, we can cause scarring. So that's what we avoid with an Environ Cool Peel. And acneic reaction. So if you have a client who was like, I'm kind of afraid to have a peel because they may have experienced a peel from somebody else and then they broke out. That's usually because the skin wasn't degreased properly in advance of the peel. It wasn't cleansed properly. So the overall effect wasn't efficient and they had a breakout. So those are some of the peeling complications. Now let's talk about the depth of a peel, and we're going to talk about the toolbox of cool peels very shortly. But in terms of the depth of the peel, there are certain factors to be cognizant of. First of all, a peel is most effective when the skin is properly degreased. By degreasing the skin, of course, we know our skin produces oil, and some of us more than others, but we have to make sure that the skin is perfectly dry before we use a cool peel product. Why? If there's any oily residue or moisture, it actually neutralizes the peel. So, it's so important when we talk about our practical component before we put, for example, a lactic acid on, that the skin is dry, that we apply that product with a dry brush, not a damp brush, because we want that active concentrate to remain stable as it goes onto the skin. Next, the effect of a peel will be the level of superficial damage of the skin. So, of course, those individuals with worse skin conditions than others, you're going to see a better effect over time. The area being treated, and finally, how well the skin is prepped in advance with the vitamin A. Because we know when we properly promote or prep the skin with vitamin A in advance of a cool peel treatment, we optimize its ability to accept that subsequent care that we offer in our treatment process. So we've already said this before, but I'm going to say it again because there's a joy in repetition, but the importance of vitamin A being that pinnacle ingredient. It's that cornerstone ingredient that prepares the skin for every day. Dr. Des always talks about how when we go into the sun or even the effects of blue light is really compromising our vitamin A in our skin. And we need to replenish that on a daily basis. For many of our clients who've never used Environ, their vitamin A receptors of their cells are so deficient. So we have to normalize the skin first for optimal health. And we combine the vitamin A with other phenomenal ingredients, such as our antioxidants, to protect from free radicals and environmental aggressors, and of course, our peptides. So our peptides become the messengers to the skin. They are those targeted solutions that go in and address what the client concern is. So the peptides may address wrinkles. They may address loss of tone or elasticity. So yeah, we have an abundance of peptides to really do the job or complete the mission that we need to. Do the job or complete the mission that we need to. So in terms of preparing our clients for a series of cool peels or any treatment from Environ for that matter, whether it be a DF treatment, we want to make sure that the client is on their vitamin A step-up system at least 3 weeks prior to treatment. And of course, if we're going to go into cool peels, we also want to make sure we have in our discussion SPF. So we have the Rad 30 available for them because we know with a peel, when we start to remove some of those dead skin layers, the skin is that much more exposed. So again, having the discussion of vitamin A prep in advance for 3 weeks and SPF at home. So let's talk about pH. So when we talk about peels, you've already heard me mention that, some clients think they have to have a very high concentration of a product. They have to have something that's, very stimulating. It has to sting. They have to crust over. And that's not the case. When we think about the human skin is a 4.7 on the pH scale. So when we look at the pH scale, we know that 0 is acidic, neutral is a 7, and alkaline is 14. So if the human skin is 4.7, which is acidic, if we were to use something that has a pH greater than that, it's not going to be effective because then we reach towards that center of our pH scale, which is neutral, okay? So we want to use something that is going to be effective, and Environ always recommends, in order for peeling to be effective, the pH level should be at a safe low level, and the percentage of acid should also be low. Going back to our pH scale, if you look at the top left-hand side, we see 20% at a pH of 0.5. So if you took an AHA acid or any sort of peel that was 20%, but it had a pH of 0.5, that's actually corrosive and very destructive to the skin. That's where we will damage the barrier and compromise the epidermal integrity of the skin, okay? If we have a peel that's 20% and a pH of 6, again, that's leaning more towards the neutral scale, and we're heading towards alkalinity, so it's not going to benefit the human skin. But if you look at the hexagons on the bottom portion of this slide, on the bottom left, when Environ, for example, formulates its lactic acid 10%, it's formulated at 10% with the average pH being 3.5. That makes it perfect because, again, that pH is slightly lower in acidity than the human skin, and that's just exactly where we need to be. But guess what? We can tailor our lactic acid applications to be even more robust or more intense depending on the skin condition we're going to treat. If we apply our lactic acid 10% and use our DF machine with iontophoresis, and we plug in our little crocodile clips with our haze gauze, we can actually, in a positive polarity, drop the pH of that peel from a 3.5 to a 2.5, make it even more powerful for that more intense treatment. What's really neat about the cool peels too is we talk about layering, and we're going to get up into this in our future slides, but we can layer the lactic acid 1 layer all the way up to 6 layers. And when we get into 4, 5, and 6 layers of the lactic acid, the concentration of that AHA starts to increase. So our first layer or two is about a 10% AHA, but as we add, multiple layers, we can make it 40%. So that's pretty amazing. So lots in the toolbox. And even more so, if we have a really robust skin, very, very thick skin that maybe has, the client's been seeing us for a very long time, not only can we layer that up to 6 layers, which brings us to a concentration of 40%, but we can plug in our field iontophoresis. Sorry, I didn't bring my crocodile clips today. Turn on our iontophoresis on the DF, and again, the pH will drop to 2.5. What does this mean in a nutshell? Well, we have the ability to increase the percentage of our AHA, and we have the ability with iontophoresis to reduce the pH, but all at a safe level that the skin can tolerate. So why do we call them cool peels, and why are they effective? Well, first of all, we are avoiding any discomfort or negative sensation for the client. So no matter how many layers we apply, the client will always feel a cooling sensation with each layer. What happens is the cooling effect is felt as the water in the concentration evaporates and the acid becomes more concentrated. So we'll see that in this diagram here. Our first application, our first layer, the water is evaporating, and the AHA molecule, or the lactic acid, is starting to penetrate the stratum corneum. Then we can apply, for example, our second and third layer. And once the acid becomes concentrated, it starts to penetrate at a deeper level. Again, as we get into some heavier layers, you may have a little bit of what I say stingling or prickling, but you shouldn't have any burning or discomfort. What I like to do if the client has a little bit of a prickling or stingling sensation, just give them a squeezy ball, or you can do, some little pressure points on their head to distraction from that sensation. But again, the experience is so non-invasive that for some or for most, it subsides very, very quickly. And finally, when we apply our third layer, for example, of lactic acid, 4th, 5th, and 6th, a greater concentration of the acid develops as the water evaporates, and we get all the way to where we need to be to help treat the healthy cells, eliminate the unhealthy cells, and again, we're stimulating and triggering those growth factors and collagen production. Collagen, 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 probably one of the biggest words in skin. What are the effects of peeling? What might they feel post-treatment? Well, first of all, the skin may feel a little bit dry or dehydrated with a little bit of flaking for the first few days. That's normal. So we want to make sure they're continuing to use their Environ skincare at home to supplement those needs. Next, the effect of light peels may be barely noticeable for some, especially if the skin's already in optimal health. You know, they may not see as big an improvement or transformation as if you had a client who had really weathered skin or very, dehydrated or sun-damaged skin. Heavy peels may be noticeable or have noticeable effects in peeling or flaking for a number of days. That's very common. Again, they're not going to shed, but they may have a little bit of, flaking around the nose or areas that needed more attention. Healthy cells survive, damaged cells are removed. So I've already said that when we have that active concentration getting to the layers where it needs to be, it is going to eliminate the unhealthy, but still maintain the healthy cells. And finally, peeling stimulates the release of the growth factors and promotes collagen formation. So again, it's all about working on that architecture of the skin or the mattress of the skin to improve its density, firmness, and plumpness. What can we expect with a course of peeling treatments? Well, treatments are going to help improve the visible signs of aging and often provide a more smoother skin. So we know that when we have a client in our treatment room or on the treatment bed, we not only look at how the skin looks visibly, but also we, in part of our consultation process, we do tactile or touch. And this allows us to feel the grain of the skin as well as its texture. We know that cool peels also improve the texture for oily or blemish-prone skin. Again, if you have an oily skin or blemish-prone skin, you may have some scarring that has left the skin rough in texture. You, again, are going to have that desquamation process, so the skin will feel less oily as we start to maintain the health of the skin at all layers. After a course of peels, the skin will appear refined, revived, and radiant. So if you have a client who has a really dull skin, maybe they're not used to exfoliating at all, a cool peel is the best jumpstart to get their regimen going. And of course, Environ recommends a series of 6 to 12 treatments for optimal results. Again, skin is for a lifetime. So depending what you want to do with your client, if you want to just maintain their skin, improve their skin, or transform their skin, may actually determine how many treatments you do in your series. Maybe you have to do 12 to 24 treatments. We're actually going to see a before and after case study of a woman who had cool peels for 2 years and a series of 56 treatments, but I'm not going to spoil the surprise because we're going to get there. So for example, maybe a client who wants to just maintain their skin, maybe they just come once a month. If they want to improve their skin, maybe we have them coming weekly. And if they want a full transformation, a cool peel may be something they want to do bi-weekly. The treatment is gentle and effective enough that they could do this. So let's take a quick look at peeling contraindications, okay? So we want to make sure that the treatment is always safe and effective for all of our clients, hence the importance of having them fill out a waiver before their treatment. First of all, if the skin is not prepared with vitamin A, it will not receive the treatment as well. We know vitamin A is that vitamin. It's the best to normalize and prepare the skin for any treatment. Next, we have cis-retinoic acid or Roaccutane. We want to make sure we avoid peeling any clients who have been on this product waiting for at least 6 months post-treatment. Microdermabrasion, dermabrasion or laser resurfacing, waxing or extractions, excessive sun exposure, pregnancy. Actually, just going to step back to waxing and extractions. You could wait 10 days post-waxing or extractions before doing a cool peel. Pregnancy. Okay, so this is always an interesting topic. So we know that topical skincare does not enter the bloodstream, making it safe and effective. But as Canadians, we always steer on the side of caution. You can have your client check with their doctor before having any sort of treatment, just to make sure they're safe and you protect yourself in terms of liability. In terms of pregnancy, we want to avoid any heavy or intense peels. So maybe we won't want to do 6 layers of lactic acid, maybe just 1 to 2 during their first few trimesters. But peeling can be done, and we can keep our peels on for just 10 minutes. We also want to avoid peels post-cancer, radiation, and chemotherapy. We know with all the chemicals that these patients have had over time, the skin can be very fragile, very thin, and very sensitive. Diabetes, skin diseases, recent permanent makeup. So if they've had any form of facial tattooing, as well as microblading, we need to wait several weeks before we apply a cool peel so we don't counteract that service that they've just received. So the best way to tolerate or gauge that is to make sure the healing process has finished with their permanent makeup and tattooing or microblading before we introduce them to a cool peel. And finally, we want to avoid a cool peel if the client has unrealistic expectations. So if they're that client who says, no, I want to have that deep peel, I want my skin to crust over, you know, I want to have what my friend had because she looks great, maybe that's not the right client for us. But I think we have all the right tools and conversation and communication that we reviewed today to really talk most clients into having effective, safe, healthy treatments with us. We also want to be careful if our client comes to us with very demarked or very evident pigmentation concerns. Now, I'm not saying that a peel is not for a client such as this, but we may want to change the direction of our treatment journey and start with something different. And so when we look at this particular lady, she's got a lot of pigmentation in her cheeks and her chin. We may actually go to doing DF treatment first. Okay, we want to really work on pigment at the deeper level. And we can do a DF treatment or a series of treatments, for example, with our Melafade serum, A and B. It's not that the cool peel isn't for her, but what we want to keep in mind is when you apply a peeling to the face, the darker areas will appear darker at first before they lighten. So that's why we say sometimes we may have to do a DF first, and then we can go to a cool peel later. So it says it right here, Environ does not recommend deep peeling as the only course of treatment. You know, when you have a client in your treatment journey, we know they're going to have a series, whether it be a series DF, a series of cool peels, or a series of needlings, and maybe even a series of needlings with their DF treatment afterwards. So we have the full rounded toolbox to offer all of those treatment for our clients. Again, we have the electrosonic ionzone DF machine, and today I'm showing you the 3rd generation, which was released in Q3 or late summer of 2021. And of course, we want them to have the right retail products for home care. And finally, if we're going to do peels, it's going to be a combination of light, repetitive peels in a series. It's not that they won't have results with one treatment, but we have better results when we follow the program. A few safety precautions. Safety first. First of all, make sure you're using the correct peel and peel protocol. Elevate the client's head, so making sure that you cover their eyes with little gauze or cotton rounds, and I usually like to moisten them a little bit, squeeze out the excess water to make sure that the eyes are protected. 3M also makes these little eye patches, although they're a little bit adhesive and sometimes hard to remove, but again, always make sure you protect the eyes, the mucous membranes such as the nostrils and the lips. Never holding any acids or chemicals over a client's face, just in case it does drip. Always have water nearby. Again, we're working with very safe peels, but you may have that client who didn't tell you something about their health history or maybe some treatment that they did recently because they don't think it's relevant and they experience burning. Well, we neutralize the peel very quickly with a cool compress and cool water. Do not allow the gels to pool. And finally, listen to the client. So I always say, stay with your client through the duration of their treatment and ask them from time to time how they're feeling and what their tolerance is. Remember, prickling and stingling is okay. Burning and discomfort and heat to the skin is not. Who are cool peels for? Well, I'm sure you're getting the gist already. We know it's for rough skin, skin with a lot of texture, skin with scarring, pigmentation concerns, fine lines and wrinkles, solar keratosis. So maybe they have decades of sun damage and now they have those lentigo solaris popping up and clumping all over the face. Rosacea, and one of my favorites, post-cosmetic surgery, because if they have scarring, the peel can help regenerate the skin and help with that healing process and fade that scar. Keep in mind, If the scar is over approximately 2 years old though, and it no longer has color or pigment in it, then the results won't be as good. But as long as there's still pigment in the scar and circulation there, you can have some great results. So let's just take a look at some of the perfect clients for an Environ Cool Peel. So first of all, problematic skin. So this particular client was treated 1 time a week, but you can treat 1 to 2 times per week in a series, especially for a transformative journey. So again, 2 times a week up to 90 days. Here we were treating post-inflammatory hyperpigmentation, and what we see as the end result, a very smooth stratum corneum. All the residual redness of the acne is now gone, and the texture, oh, it's just smooth. It's beautiful. There's no more bumpiness. Again, we have another client here who has acne, more of the fungal acne on the forehead. And this particular client was treated with a series of cool peels 2 times a week for 6 weeks. And we see not only did the cool peel alleviate the irritation and the redness that we see associated with the bumps, we see a smoother stratum corneum, so very, very smooth texture. And we're going to reduce obstructions and future pimples and pustules from forming. Because remember, with the active concentrate, we have the ability to penetrate the pores and the hair follicle to eliminate any debris or blockages that are preventing the skin from breathing and from active ingredients entering. The beautiful desquamation process here. Next, we have a client with rough skin. So we know a cool peel, when we touch the skin during our consultation, if the skin feels really rough, we can work on the grain and the texture. And if you actually take a look at this particular client after a series of peels for 4 months, the texture in the skin and the pore size is visibly reduced, especially in this area here, in that T-zone area of the cheek. Pretty phenomenal, right? How about this one, rough skin? So not only with the aging process do we see laxity, but we see the increased wrinkle depth, fine lines and wrinkles with the aging process. So here we know we boost collagen production and growth factors, which in turn plumps and densifies the skin. This was a client's arm that was treated after a period of 6 weeks. Again, a client with rough skin. This is the lady that I was telling you about earlier in our training today. She had 1 treatment a week, totaling 56, 1 treatment a week. There was a little bit of a break in between, but she had a total of 56 treatments over 2 years. And you can see a definite improvement in terms of the pronounced laxity in her skin. You can see an improvement in terms of the density of the skin. So the nasal labial folds are less pronounced. We see a little bit more volume in the cheeks, great smoothness. Even the sagging, we started to see the jowls in this area here shifting down more. What a great result. And the skin looks pure, it looks radiant, and it's glowing. Another great before and after, again, all about working on the aging process. Look at the overall glow on this client's skin. It became, it was very muddled and very mottled before. Now it's glowing, radiant, and crystal clear. Huge difference in the terms of lines and wrinkles on the forehead. Even the sagging under the eyes is now reduced. You can barely see that darkness or that hollow. And of course, nasal labial folds are less pronounced. And of course, the lines or vertical lines around the mouth are visibly reduced. Another client who had fine lines. So again, she didn't have so much of a transformation, more of an improvement to her skin. Beautiful results with clarity and reduction of wrinkle depth. She had a series of light peels to minimize all of these conditions, and we see definite improvement in her collagen levels and plumpness. Next, a client who was treated for her solar keratoses. She had 1 treatment a month for 6 months. And again, look at the difference. Oh, the lenticula solaris are almost gone. Reduction in visible redness in the skin, reduction in lines and wrinkles, so much clearer. Who had rosacea. So, we get this question a lot, whether it be broken capillaries or rosacea. Is a cool peel safe for these skin types? The answer is yes. because the cool peel, as long as we're using, for example, maybe just one layer, we're gauging the tolerance of the skin. We can leave it on for a little bit less time, but it's going to help our other active ingredients, whether we're using a colostrum product or something hydrating, to penetrate and actually treat the skin where it needs to be treated. Keeping in mind, a cool peel may initially aggravate the redness for the first few visits, but over time, we are going to see beautiful clarity and stronger protective barrier as well.